Clicking and popping in the jaw joints, which are also called the temporomandibular joints, or the TMJs for short, is a fairly common finding in my experience. The TMJ is a very complex joint that involves the articulation or connection between the temporal bone of the skull, also called the socket or fossa, and the condyle of the mandible or the lower jaw. It's like a ball and socket. It is a very unique joint in that it functions two ways. It rotates open and closed, just like a hinge, and it also slides or translates down the slope of the eminence or socket on real wide opening and in right and left movements. It contains a fibrocartilage disc that acts as a cushion and facilitates the smooth movement of the temporomandibular joint. When one has a TMJ problem or disorder, which is a catch-all term, it can be the joint itself, the structures within the joint, or the muscles around the joint. If the TMJ disorder involves pain, you have to diagnose which structure or structures may be involved as the source of pain. My experience has shown that most often it's not the joint or joint structures themselves, but rather the muscles around the joint, in particular the medial and lateral pterygoids. You can check these muscles yourself at home as demonstrated in the video entitled, "Where is the Pain Coming From?" in the Videos tab. If the joint itself is the source of pain, it will be tender if you press right in front of the tragus of the ear. That is the location of the TMJ. Or if you do the cotton swab test. Biting firmly on cotton swabs placed right behind the eye teeth on the bicuspids will load the joint and may produce pain right in the joint if indeed that is the location of the problem. But again, I don't find this as a common occurrence due to the unique structure of the TMJs, which provides a robust healing and remodeling capacity of those joint structures. A regular cartilage disc found in many joints throughout the body consists primarily of hyaline cartilage. It does provide cushioning and helps reduce friction between the bones during movement. However, if it becomes traumatized or damaged, it has a very limited reparative capacity because it lacks blood vessels and nerves. In the TMJ, however, the disc is specialized and often referred to as a fibrocartilaginous disc. This TMJ disc differs from a regular cartilage disc in several ways. The TMJ disc contains both fibrous and cartilaginous tissues, giving it a unique composition. It has both type 1 and type 2 collagen. It's composed of a dense fibrous connective tissue along its periphery and fibrocartilage in the central region. The fibrous component can help the remodeling and adaptation. This TMJ disc is thicker and more robust compared to regular cartilaginous discs found in other joints. The retrodiscal tissue, that is the tissue behind the disc, is highly vascular and innervated, and it allows for nutrient exchange and to facilitate the repair and adaptation process. The joint is surrounded by a synovial capsule to produce synovial fluid, which helps nourish and lubricate those joint structures. The fibrocartilage TMJ disc serves several important functions in the TMJ, including shock absorption, load distribution, and facilitating the smooth movement of the mandible. It helps maintain proper joint alignment and stability during jaw movements such as chewing, speaking, and yawning. The TMJ disc can adapt to changes in joint loading and function over time. It may undergo remodeling in response to mechanical stresses from trauma such as accidents, sports injuries, clenching and grinding, which is a very common occurrence, or some pathologic conditions that can affect the shape of the condyle, all of which can affect its structure, but still allow function like a normal disc after some healing and adaptation. There is a muscle attached to the front of the disc. It's called the lateral pterygoid muscle. For more information on this lateral pterygoid, see the video, "Where is the Pain Coming From?" When clenching and grinding, or if there are bite alignment issues, or sometimes head and neck trauma, this lateral pterygoid muscle can hypercontract and actually pull the disc forward, and it's called an anteriorly displaced disc. This disc is now in front of the condyle and can limit movement. When this happens, the tissues behind the disc, the retrodiscal tissues, have blood vessels and nerves, and they are now in the functioning area of the joint. Since it's highly vascularized and innervated, it can initially be painful, but the beauty is that it can remodel and adapt over time and function just like a normal disc. A special mouthguard may be needed to help this process. There may be some clicking and popping, and the opening and closing movements may not be perfectly smooth, but this is usually of no serious consequence. It is more an observation rather than a serious problem. A few patients have a much wider range of motion, often because the slope of the eminence may be very shallow. In these patients, upon real wide opening, the condyle will slide down that shallower slope of the eminence and actually go over the crest of the eminence, sometimes with a thump. It may be alarming, but it's not pathologic. It is more a variation of normal. At times, it may be difficult to slide back and be quite scary. Just relax the muscles and it will slide back. In rare cases, assistance may be needed from the dentist. And try to remember not to open that wide again. It's kind of like swinging your arm or leg too far. Overall, the fibrocartilage TMJ disc is a specialized structure that plays a crucial role in the function and the health of the temporomandibular joint, and is what allows the unique remodeling and adaptation. Its unique combination and properties and its robust vascularity make it well suited to withstand the demands placed on the TMJ during the various activities of daily living. This very robust vascularity also gives it to the ability to respond and heal well to low-level laser therapy if it's injured or sore. This vascularity also allows joint supplements to enter the joint and nourish the structures and allow healing and adaptation. These can be found on www.holisticdentallearning.com in the low-level laser and supplements tab. In conclusion, the temporomandibular joint, with its unique fibrocartilage disc and remarkable adaptive capacity, exemplifies the intricate and resilient nature of the human body. Understanding its structure and function not only sheds light on the complexity of this unique joint, but underscores the importance of holistic approaches to oral health care that aim to support and optimize the natural healing processes of the temporomandibular joint.